Welcome to the Adult Primary Care COVID-19 Guidance for managing adults with COVID-19 in an inpatient setting. This is the first version of this guidance and aligns with version 5 of the National Department of Health and NICD guideline for clinical management of suspected or confirmed COVID-19 disease, as well as the latest 2019 hospital-level standard treatment guidelines and essential medicines list for South Africa. This guide complements the APC COVID-19 guidance for primary healthcare facilities, as well as the APC 2019-2020 guide, with which many of you may already be familiar. APC is a comprehensive, integrated guide which has been used in primary healthcare facilities throughout the country for some years now. Our COVID-19 guidance follows the same easy-to-use format, using algorithms, tables, and an assess, advise, treat structure. Red boxes indicate when a patient may require more urgent attention. Boomerang arrows are used to refer clinicians to other pages in the guide when appropriate, and medications are highlighted in blue. Please note that should a medication not appear in the APC guidance, this does not preclude a clinician from prescribing the medication, so long as the clinician is comfortable prescribing it and is acting within their scope of practice. We will now take you through the guidance to highlight some of the content. Page 3 assists clinicians to determine the appropriate initial level of care for patients with COVID-19. This ranges from being treated at home to being admitted to an intermediate care facility, a PUI or COVID-19 ward, or to a high care or ICU setting. Pages 4 to 6 provide guidance on the general management of patients admitted with COVID-19 and follow the assess, advise, treat format. Page 4 should only be used when admitting the patient, while page 5 should be used for ongoing daily monitoring of a COVID-19 patient in the ward. The 3 shades of brown used in the assess table indicate history, examination, and investigations. Page 6 covers what advice and treatment to give and when to consider discharging the patient. Patients with diabetes are at a significantly higher risk of developing severe COVID-19, especially if their diabetes is poorly controlled. We have included guidance on the management of diabetes in the context of COVID-19 to assist clinicians who may be less experienced in this area. The red box on page 7 covers management of diabetic ketoacidosis and hypoglycemia, while page 8 provides guidance for routine care of patients not needing urgent attention. As there is currently no formal local national guidance on the management of patients admitted with both COVID-19 and diabetes, this section is aligned to the latest hospital standard treatment guideline and essential medicines list. If you are unsure at any stage about the management of such a patient, we suggest you discuss their care with an experienced doctor or specialist. Should you need to take a swab for SARS-CoV-2, this page explains how to do this procedure correctly. The Safe Practices section on pages 11 to 18 cover infection prevention and control measures, including the appropriate use of personal protective equipment, tips on what to do before and after work, how to take a break safely, and how to travel safely using public transport. Should a health worker be exposed to a person with suspected or confirmed COVID-19, pages 19 to 21 provide an algorithmic approach to determining the level of risk of the exposure and clearly advise how to manage the situation appropriately. In addition to curative and supportive care, patients with COVID-19 may also require palliative care. Pages 22 to 25 provide more detail on both palliative and end-of-life care, with a focus on management of breathing difficulty, pain, anxiety, and other common symptoms presenting in these patients. Should a patient succumb to COVID-19, there is guidance provided on how to safely handle the patient's body and how to correctly complete a death notification form. The response to COVID-19 is rapidly changing as new evidence becomes available and health systems adapt. The Knowledge Translation Unit welcomes feedback on this guidance as it continues to be updated for future versions. Should you have any feedback, please send this to us by following the link provided on page 2. If you still need to download a copy of this guidance, you can do this on the National Department of Health Knowledge Hub or the Knowledge Translation Unit website. We hope that you find this guide useful and that it provides you with more confidence when managing patients admitted with COVID-19. We thank you for your dedication towards helping care for COVID-19 patients and managing this epidemic.